Hey guys, Tony Maritato here, licensed physical therapist, and I wanted to answer a question that came in through the Facebook group, Total Knee Replacements for Kind People. That's the name of the group if you want to check it out. Totally free. We have 6,600 members or so in there. Really amazing community. But anyway, the question was, uh, the patient is doing PT. They had 120 degrees of flexion, 7 degrees of extension. And when I say negative, 0 would be full extension, so they're lacking 7 degrees. And 130 flexion with pressure, and 5 degrees of extension with pressure. So this particular person, the therapist, told me that because the surgeon measured extension at 8 degrees in the operating room and 5 is the best I can achieve, I'll have to keep up exercises to maintain that. Does this seem correct? I've been bone on bone for 6 years, and that, she said, has permanently affected my hamstring. Okay, so I love these questions. These questions are awesome. Questions, answers, much of this is really opinion. Let me start with that. There is no magic ball. I can't tell you for certain, but what I can tell you is it certainly is not related to the hamstring. Now, I'm not disagreeing with your therapist. It's true. In fact, one of the best indicators for how you're going to recover from a total knee replacement in terms of range of motion depends on what your range of motion was before the knee replacement. I always try to get videos, especially in this day and age, videos of my patients before surgery, so I get a sense to see how they were walking, how they were moving, what the previous knee looked like compared to the new knee. Now, the goal is going to be we want full extension, but if your therapist was saying, based on the operative report, that the surgeon was only able to get you to 8 degrees of extension in the operating room. Now, what I'm not sure about is, was that after surgery or before surgery? There's certainly a reasonable doubt that it's going to be more challenging for you to achieve full extension after your recovery. But that being said, let's talk about some of the factors that could be limiting it and what you could be doing to improve those factors. So the hamstring is a muscle. The muscle is like a rubber band. The muscle is never going to limit your ability to achieve full terminal knee extension. What's going to limit the ability is the connective tissue, the joint capsule, the ligaments, and the structures that surround the back of the joint. If any of you have ever had like a Baker's cyst or any kind of swelling or sensitivity in the back of the knee, you understand. You try to straighten the knee, it kind of hurts, it pulls. You try to bend the knee, it pinches that area, causes a different kind of pain. So absolutely, that connective tissue is massively strong. It really is. It's incredibly strong. But that being said, every tissue in the human body adapts. It changes. It adapts to the stresses placed upon it. That's basically what I'm trying to say. So with time, with consistency, with doing enough but not doing too much, you will absolutely improve as much range of motion as you need to function throughout your day. Now, my question would be, your body most likely adapted to the previous level of knee flexion, knee extension. So I don't necessarily know or want to imply that getting 0 degrees of knee extension is really the best thing, because what could end up happening is all of a sudden you've got this knee with more extension than you used to have. Now functionally, your body's not used to that longer leg, because the leg is going to be longer with full knee extension compared to negative or lacking 7 or 8 degrees of extension. Is that going to mess up other components of your body? Is the rest of your body going to have to adapt? It will, no matter what. Your body always will adapt. Your body is amazingly resilient, strong, adaptive. But I just want people to understand that the numbers don't matter. And I would even say, like, to measure me with 21 years in the clinic and doing all this, there is no way I can consistently measure knee extension, even flexion, to within 5 degrees of a margin of error. On any given day, at any given time, I'm going to be all over that. Sometimes it's 3 degrees, sometimes it's 5, sometimes it's 7. That's just the nature of measuring terminal knee extension. What I would tell you to do is, one, Don't let anybody tell you what your body's going to do. Your body is going to do what it does. It's going to adapt to the forces you place upon it. That's what's so amazing about the human body. 2, you focus on the things that you want to do. Who cares about numbers on a little plastic measuring device? What's important is, are you living the life that you want to live? Did you have this surgery to get out and do more things? If so, are you doing them? Don't get hung up on the numbers. I appreciate what the therapist is saying, and I think what the therapist is probably doing is trying to prepare you a little bit to say, look, it's not a big deal if you don't get to 0. Don't let other people freak you out because they say they're at 0. I've measured plenty of knees that I didn't believe were at 0, that other clinicians measured at 0. I would just tell you there's a margin of error in goniometry. The numbers don't matter that much. Focus on fun, focus on function, focus on the things that you want to do. And thank you so much for posting that question. I always appreciate it. Guys, if you're still listening, I would love to know, would a kind of open office hours help you guys at all? Like if I did this YouTube channel, and I had maybe a block of time where I came on live consistently and I just said, hey, any questions, whatever you guys want to know, either jump on a call and I give you a phone number or post them in the comments. Is that something you guys think you would enjoy, you would use, would benefit you? Let me know in the comments below. Otherwise, I'll catch you next time.